Hello, my name's Madeline Flanagan, and I'm the Programme Leader for the MSc Clinical Dermatology at the University of Hertfordshire, and I'm also the admissions tutor for the programme. I head up a team of expert clinicians who are also academics, and they want to share their knowledge and experience of dermatology with you. We actually support a wide range of overseas and home students who have a particular interest in dermatology. This dermatology programme focuses on the clinical management of chronic skin conditions such as eczema, acne, psoriasis, skin cancers. It'll improve your clinical skills, for example, your patient consultation skills. It'll help you identify disease severity, and it'll improve your all-round diagnostic skills. We'll actually teach you to identify and critique the evidence base so that you can make clinical decisions that will improve patient outcomes. Towards the end of the programme, we give you opportunity to consolidate your learning by going on short observational placements in a busy National Health Service dermatology department. And you'll be able to compare practice with that department and practice at home. At the end of your programme, you'll have the opportunity to participate in a service development project. This is where we will show you how to plan and implement a change in dermatology practice that you would like to implement back at home with your own patients. This isn't a dissertation. Dissertations are reserved for PhD projects. So this piece of work is a shorter piece of work that is very clinically focused and very useful to you once you return back home. The teaching style used on the programme is based on the clinical experience of your tutors, all of which currently work in clinical practice and are experts in their own field. We use a variety of teaching methods on the course, ranging from traditional classroom discussions right through to a range of technology, online learning techniques. We include simulation of clinical scenarios and problem-based learning. And this means, as well as your clinical skills improving, you'll improve your presentation skills, your information retrieval skills, your critiquing, and your academic writing skills. The team are particularly keen to find out about yourselves, and we will get to know you quite well because we have small teaching groups. The largest groups that we teach are around about 50 students, and typically our student teaching groups are much smaller, 20 to 25 students. So this means that we will get to know each other, we can share and network, and particularly one of the advantages of the programme at University of Hertfordshire is the mix of home students and overseas students. So this gives us a unique perspective so we can share best practice. One of the most important things that the team does is provide support for our postgrad students. We do appreciate that it can be difficult living away from home and that you all have family commitments as well as postgraduate study. This means that right across the course you will be allocated a personal tutor, and that personal tutor is there to advise and support you with any issues that you might have. That tutor will also look at your coursework and can advise on drafts of your work so that when your final submission comes around, that you've had personal input and specific feedback to help you get the best marks that you possibly can. You're also supported by an excellent and comprehensive student support system at the university, and they can help you with all sorts of issues ranging from academic issues, financial issues, or how to improve your social life. So, as an admissions tutor, what makes a good student for the programme? Well, you need to be somebody with a real passion and enthusiasm for dermatology, but you do need to have practical experience with caring for patients with chronic skin conditions and not just an interest in the speciality. We need you to be self-motivated and keen to embrace learning in a new country, and you must want an academic challenge and be keen to network. I'm now going to explain how to make a good application to the MSc Clinical Dermatology. First of all, we have 2 intakes a year, one in September and one in January. So this actually means that I will consider applications all year round. You can contact me directly to ask any questions, and then I can clarify things for you on an individual basis. But the starting point, obviously, is to look at the specific entry criteria to the course and make sure that you actually fit those criteria. You can apply either via me, send your documents to me, or via our admissions department at the university, and we'll supply you with all the right documentation. Please follow the specific instructions that we give you, because it's very important that I can actually identify what clinical experience you have, how long it is since you've qualified as a doctor, and how much dermatology experience you have. You don't have to be the world's expert in dermatology to come on the programme, but you do have to have some experience of managing patients with skin conditions. So you might have worked in a hospital dermatology department, or as a medical officer. You may well have been a GP handling patients and their skin problems in an outpatient department, or you might have worked in primary care or in a rural hospital. But I do need you to tell me about those patients and your own experience, the type of conditions that those patients have. And if I can't see that in the application, that's usually when I have to request further information from you, and that can delay your application procedure. So check you meet the criteria, clearly document and answer all the questions that I ask of you, and then submit all the documentation, if possible, at the same time. If you are missing documentation, again, this means a delay and will slow the whole process down. And as you probably know, the Tier 4 visa application process is quite complicated, so it's best that we get everything in at the same time. And as I've already said, ask me if you want any specific clarification on issues. So we need your qualifications, scanning, we need your passport, we need evidence of your English proficiency, and in fact we can receive your application without the English proficiency, but if something is missing or we're waiting for a test result, then we can only give you a conditional offer rather than an unconditional offer, so please bear that in mind. It's also important for you to write a good statement of purpose. You will also have a credibility interview, and you need to make sure to prepare for that you are fully aware of the details of this specific program at this specific university. You understand what the content is, you understand how the program is organized, and you understand the unique benefits of coming on our particular programme and to this university. You'll also need to make sure that you understand the financial criteria for Tier 4 application, and a lot of that information is available on our international student web pages, so please check those out. References are obviously an important part of the application process, and it's particularly important to have your clinical experience of managing patients with chronic skin conditions confirmed by a senior clinician. So I need references to state the date that you started your dermatology experience and the date you finished. It needs to describe the types of patients that you have been managing, types of procedures that you've been involved with, and obviously it needs to tell me a little bit about your personality and your application to clinical practice and how you might benefit from studying this degree programme. Please make sure that your referees complete the reference on headed note paper, that they provide contact details and their full name, address and designation. They need to make sure that the reference is dated, and that needs to be current within the last 6 months to 1 year of the reference being written. I'm not interested in references from your time as a medical student, because this has really very little relevance to your postgraduate studies. Aesthetic references are fine as long as the referee confirms your experience looking after patients from their chronic disease management perspective. So we do need to know about your clinical experience of managing patients with skin disease. But without good clinical references to show recent clinical contact with patients, I'm afraid you won't be accepted onto the programme. Because this is a clinical programme relying on clinical skills, we will develop those clinical skills. So we need to make sure that you've recently been in practice. So how can the MSc Clinical Dermatology help your future career progression? Well, first and foremost, it'll make you a better clinician. Your confidence will increase as your ability to diagnose and manage chronic skin conditions improves. You'll become familiar with evidence-based practice and the supporting clinical guidelines of protocols that go alongside that. You'll have discussed at length the advantages and disadvantages, different treatment options for different types of patients. Some of our students go on to study their PLAB test to register with the General Medical Council while they're studying their degree, and then go on to get a job as an NHS doctor. Students who get good grades will be encouraged to apply for PhDs and may well get involved in research projects as research assistants in British universities. Some students go home and get appointed as lecturers in local universities and share the knowledge and experience that they've gained on this programme with others. What I can guarantee you is when you do leave, you'll understand dermatology practice in the UK, you'll have made a great set of new friends, and you'll be part of a wider dermatology network that's improving the lives of patients with skin conditions.